For the third straight day this week, Molly is awake from sleeping due to intense hunger cravings at 2 in the morning. Soon, the cravings take over her mind and body, leaving her eating tonight's leftovers. This happens 2 more times throughout the night. Feeling shameful, she wonders why this keeps happening to her. Night eating syndrome, also known as NES, may be the reason. In this video, we will be discussing what night eating syndrome is, its main causes and negative effects, clinical diagnosis, and clinical treatments.
Night eating syndrome is a type of eating disorder where a person consumes 25% or more of their caloric intake during the night. This includes after dinner and when awake during the night. Most symptoms occur at night because many people with this disorder believe that they cannot sleep without eating. Anxiety is very common in people who are suffering from night eating disorders. Many people who suffer from night eating disorders also tend to be obese. It is unclear whether obesity is the cause or effect of night eating syndrome. About 1.5% of people in the United States suffer from night eating disorder. Worldwide, it has a prevalence between 6 to 16% in people with obesity.
Currently, medical professionals don't know the specific causes of NES. However, they believe NES may happen due to a few factors. First, NES may develop over time with university students or working adults who pick up an endless routine of eating their meals late at night because of hectic school and work schedules. Second, NES is associated with decreased leptin and melatonin hormone production in the brain and levels in the body that control hunger and sleep cues. Low leptin levels cause the brain to mistakenly think the body is very hungry, leading to uncontrollable food consumption and increased hunger and appetite. Low melatonin levels can interrupt an individual's circadian rhythm, which functions as a 24-hour cycle clock that runs in your head. If your circadian rhythm is functioning on time, it ensures your sleep-wake and eating patterns are followed as scheduled. However, if the circadian rhythm is delayed, natural sleep-wake and eating patterns become heavily disorganized. Third, NES episodes may be a reaction to restrictive dieting during the day, in which the ability of the brain to resist hunger, eating, and food cues disappears at night, leading to a large consumption of foods each night. Fourth, individuals diagnosed with one or multiple mental health conditions, such as anorexia, depression, binge eating disorder, anxiety, and substance abuse, are at a higher risk of developing night eating syndrome. Frequent episodes of NES can be a very unsettling and stressful experience, as individuals struggling feel out of control of their night eating habits, resulting in several negative effects. If one's sleeping schedule is constantly disturbed by NES, it will hurt their overall ability to function and complete everyday tasks during the day due to prolonged fatigue and impaired mood, attention, concentration, and memory skills. One may also have worsening feelings of guilt, shame, anxiety, and depression over their behavior, decreasing daily productivity. Additionally, consuming so much food multiple times at night can lead to significant weight gain, high blood pressure, obesity, and other serious weight-related health problems. For the clinical diagnosis of night eating syndrome, the Diagnostic Statistical Manual 5, also known as the DSM-5, which is a mental health and brain-related condition and disorder reference book, classifies NES as an other specified feeding or eating disorder. This means that NES has symptoms that are alike to one or more other eating disorders, but may fail to meet the whole criteria for these other eating disorders. Therefore, the DSM-5 has outlined a 5 feature criteria as a clinical NES diagnosis method, which are 1. A lack of desire to eat in the morning. This involves frequently skipping breakfast or having a reduced appetite upon waking. 2. Urges to eat at night, specifically with strong desires or urges to eat during the night, distinct from normal hunger cues. 3. A belief that eating is necessary to sleep. In particular, feeling the need to eat to fall back to sleep during awakening at night. 4. Having a depressed mood. Associated symptoms include sadness and hopelessness, with them being more pronounced in the evening. And 5. having difficulty sleeping, or an individual struggles with the sleep onset or maintenance. To be fully diagnosed with NES, an individual must satisfy 3 out of the 5 criteria features listed.
Lastly, we will be discussing the current treatments one may undergo to treat NES. Cognitive behavioral therapy is a treatment that enables one to speak about their emotions and thoughts with their therapist to determining what triggers their NES. During these therapy sessions, therapists work hand in hand with patients to identify their food patterns, sleep patterns, and their day-to-day life. By recognizing these habits, therapists can help create a plan for you that may work. This can be having an increased portion size for lunch or for dinner, scheduled meal times, and you may be placed on a dietary restriction to help with regulating a normal bedtime schedule to prevent NES. As well, therapists may suggest physical activity to help with food intake and sleeping habits. Next, bright light therapy is used to improve the patient's sleeping habits and night eating symptoms that are experienced. This can be done because this therapy helps regulate circadian rhythms by lessening the amount of times an individual wakes up due to NES. This in turn helps with their sleeping habits by letting them sleep throughout the night. Bright light therapy can also be associated with improving overall mood and anxiety, as NES has a direct link with negative moods and anxiety. This can cause patients feeling happier and more energized throughout the day. Lastly, progressive muscle relaxation is an exercise which focuses on tensing the muscles, then releasing them to create muscle relaxation. This causes the mind and body to fully relax, which can help patients have improved sleeping quality with NES.
To summarize, night eating syndrome is an eating disorder where an individual awakes several times at night and cannot fall back asleep without consuming food. Those struggling with NES, due to a variety of possible factors, may experience negative effects such as poor day-to-day functioning and anxious feelings, but with proper clinical diagnosis and treatment, NES is manageable. Thank you for listening.